Good day, everyone. I am Kristie King, the Executive Director for the Southeast Michigan Senior Regional Collaborative, or also more affectionately known as the SRC or the Senior Regional Collaborative. In today's video, The Human Garden, Assortment and Diversity in Aging, we'll briefly discuss what the heterogeneity of aging means and how it applies to seniors in Michigan and throughout the nation. But first, a little bit of information about the SRC and what we actually do. The Senior Regional Collaborative is a nonprofit association of government and nonprofit organizations that serve seniors, persons living with disabilities, and their caregivers. We provide our member organizations with networking, training, and funding opportunities, helping them to build partnerships and improve the quality of life for older adults and people with disabilities and their caregivers in and throughout Southeast Michigan. Our journey today will begin with a brief introduction to the topic and some background information and some clearly significant statistics. We will then move on to the definition of heterogeneity. Afterwards, we will discuss what the current system of aging looks like today, as well as a general overview of the science behind aging. Finally, we will discuss some of the risk factors that are associated with heterogeneity and the current gaps in resources that may be faced as a result. Before we dive into some of the data, I would like to begin by saying that aging is such a unique process. People have a unique set of needs as they grow older. However, this does not necessarily stay the same between person to person. The 65 and over age category is very misleading, as it tries to group individuals within a 40-year age range together and apply some general resources to meet their needs. However, take a look at this image. The tomatoes are all growing on the same vine, but they are all ripening at different rates. Just like the tomatoes, the senior community is just like a garden. Although individuals may fall within the same age category, people age uniquely and at different rates. Therefore, it is essential that these unique traits in aging are acknowledged in order to make the greatest impact. Now let's start to break down some data made available in 2019. There are 703 million seniors on average over the age of 65 globally. This means that seniors make up about 9% of the global population. There are 54.1 million seniors in the United States. The Population Reference Bureau further noted senior population in the US was expected to double to 95 million in around 2060, based on some 2018 data. In Michigan, there are 1.7 million seniors, which translates to about 38% of the overall population here. As you can see by this data, seniors make up a significant portion of the population throughout the US and Michigan, and globally. Let's take a moment to consider this population impact and power of seniors. Now, let's focus on the senior population in the state of Michigan. Michigan has also undergone great change as it relates to the growing senior population. For example, there has been an observed 10% increase in the senior population from the 50s to 2019. Therefore, Michigan has an average population age of 39.8, which is a year higher than the national average. 21 out of the 83 counties in Michigan are also over the age of 50, ranking Michigan as the oldest by county. Also, most significantly, Michigan is ranked 14th in the US for a population over the age of 65. Now that we have a better understanding of what aging looks like throughout Michigan and even the world, let's start defining heterogeneity. In simple terms, heterogeneity is the variation in the way people age. But the reality is we live in a time where aging is made to be simple, when it is actually one of the most complex subjects there is. Oftentimes, you will hear heterogeneity used synonymously with diversity. However, one should be cautious when using this terminology, as diversity can play a role in heterogeneity, but not necessarily share a definition. This is because heterogeneity is an umbrella term for multiple factors that can contribute to differences in aging, while diversity is group specific and ties to certain cultural groups. Therefore, heterogeneity does not equal diversity. Now that we know what heterogeneity is, let's dive a little further into a deeper conversation about the cultural differences behind aging. In Western culture, there's a very heavy emphasis on the young adult population, which leaves the senior population with a lot of challenges to overcome. These challenges are especially prevalent in the access to healthcare specifically. When seniors are not able to access healthcare, they are less likely to receive their required medications, for instance, which can definitely be detrimental to senior health. In addition, it was found that when compared to other countries, seniors in the US were sicker. In Western cultures, there is a greater need for social programs. This can be especially difficult to achieve, as much of the efforts in the US are rather put towards emphasis on healthcare itself. Finally, Western countries tend to struggle the most with ageism, which makes it difficult for seniors in countries like the US to thrive as a result of existing prejudice and stereotypes around aging itself. There are currently 10.6 million seniors in the workforce in the US. Therefore, ageism can have a major impact on these individuals and other seniors, making significant impacts in their communities. On the other hand, Eastern cultures view seniors differently than the West often do. Data has indicated that Eastern cultures may hold greater respect for seniors as a result of differences in values. Apart from cultural values, seniors also face less challenges accessing healthcare since most Eastern countries have universal healthcare programs. Furthermore, since these countries do not have to worry about promoting or finding a private health insurance or federal programs, they are able to focus more on the social programs to provide those additional resources to their seniors. Now let's discuss the demographics of aging in the United States. According to the Administration for Community Living, or ACL, 23% of the senior population in the United States are racial minorities, with the highest percentage of seniors being African American, followed by Hispanic, and then Asian. As you can see, the diversity among the senior population is significant and is expected to continue growing, as reported by the Population Reference Bureau. Now that we have discussed the demographics of the senior population, let's talk about the location of seniors across the US. This map shows the overall spread of seniors by state, with most of the senior population being concentrated in states such as Florida, Maine, West Virginia. It can also be noted that most seniors appear to typically favor the East Coast and Midwest. These specific patterns and location have contributed to the rising aging in place phenomenon, where seniors are left to age in their states as young adults move out and move on. Now, you are probably wondering, why are seniors choosing to retire or live in some states more than others? Let's further discover the reason behind these trends and the impact they can have. This map shows the 9 states that make up over 50% of the current senior population, with the most seniors residing in Maine, making up 21% of the population. There are few factors that can contribute There are many factors, that can contribute to specific states having a denser senior population than others. For example, it could be state tax, cost of living, weather, and recreation and lifestyle. Out of the states listed on this map, 8 have a low cost of living and or little to no state taxes, making them more appealing for retirement. For instance, Texas and Florida have no personal income tax. Pennsylvania has very low personal income tax, and Michigan, Illinois, Ohio, and North Carolina are in the top 25 for lowest cost of living. Furthermore, if we look to California and New York, which are well known, they're populous, very populous cities, and they're compelling tourist attractions and liveliness, making them an ideal location for seniors, especially those that are retired. We have now gone over the demographics and geographic spread of aging throughout the US to better understand where seniors are making the most impact. Now, let's discuss some of the common misconceptions with aging and uncover the truth behind them. So, some aging myths. Some believe that with aging, you should expect to struggle with depression and loneliness. However, this is in fact false. Young adults are more likely to develop depression than seniors. Although growing older may have some new challenges, this does not mean seniors cannot have strong relationships with their loved ones and others. It is also believed that seniors should prepare themselves for their development of Alzheimer's or other forms of dementia. This is also false. Not all seniors will develop a form of dementia. Old age may come with some mild forgetfulness, but not necessarily Alzheimer's. And who doesn't forget things often or sometimes? The risk of dementia does increase with age. However, these concerns can be addressed with normal check-ins with a physician. Furthermore, if you had a family member who developed Alzheimer's and dementia, then this does not also mean you will inherently develop Alzheimer's. There are many factors that contribute to the development of dementia. However, by maintaining a healthy lifestyle, the likelihood of developing the disease decreases significantly. Next, many people believe that once you turn a certain age, the windows of opportunity closes to learn new things or take on new hobbies. However, this is in fact the opposite. Seniors should be actively challenging themselves by trying new things. It is important to engage in these activities as they can improve cognitive function and memory. The final myth is that seniors should not exercise because it is dangerous and they're fragile. And as with all the other statements, this one is also false. Exercise can help seniors with mobility and serve as another outlet for them to practice good health tactics. Although some older adults may be restricted by disability or illness, even a small amount of physical activity could help improve their overall health. So as you can see, these are just a few of the common misconceptions associated with aging. But by uncovering the truth behind them, we as individuals can better equip ourselves with the right information to age healthily. So we have already defined heterogeneity earlier in this presentation as the variations in the way people age. But if there are so many unique ways to age, then is there a systematic way to define aging? Let's talk about what the systems of aging look like and how it's broken down in the US. Who is considered a senior? We know, depending on where you are, seniors can be defined as young as 55 and over. But according to Dr. Frank Newport at Gallup News, seniors are typically determined by age group, which in the US is typically anyone over the age of 65. This age category is considered the largest since it can cover a broad age range up to and over a 40-year span. This may be a convenient way to classify seniors when it comes to collecting data, but it neglects to take into account the physical, mental, and generational differences of aging. Seniors are also commonly categorized even further by Freud's frailty phenotype, which focuses on the physical characteristics of being a senior. This characterization is broken down into three groups: non-frail, pre-frail, and frail. However, these systems alone fail to capture the diversity of the senior population. I know you are now most likely wondering, is there a way we can properly categorize seniors and also take heterogeneity into account? An article from the Frontiers of Public Health has outlined a better system that would ideally describe aging. This system was intended for better clinical evaluation of seniors, but its breakdown further supports the idea that seniors have a different set of needs as they age. This system breaks down the 65 and over age group into four categories: 60 to 69, 70 to 79, 80 to 84, and then 85 and over. In each category, there are specific recommendations from a clinical review. These categories are normal aging, disease, emotional, and social. Systems like these allow for a better understanding of the senior population by breaking them down into more specific groups that can be better supported rather than trying to compare a 65-year-old directly to a 90-year-old. Data collected from these groups can be used to find gaps in the senior population and appropriately address them. By implementing aging systems like this one, for instance, there will be a better understanding of heterogeneity and the role it has in aging. So now that we have outlined some ideas around identifying current systems for aging, let's discuss the science behind aging. We have talked about aging throughout this presentation, but what is the formal definition of aging? From a scientific perspective, aging is defined as the following. Aging can be conceptualized as a dynamic accumulation of molecular and cellular damage that is continuously counteracted by resilience strategies that have been evolutionarily selected for their ability to maintain homeostasis and function in the face of varied stressors. This definition is very complex and may not have immediately been understood upon first hearing it. However, this definition is an excellent way to understand the way aging is interpreted today. Similar to the way you may have expected a simple definition of aging, we try to simplify the senior population by categorizing them into age groups of 65 and over. Okay, so now let's break down what this definition really says. As we grow older, so do the cells in our body. And as cells grow older, normal processes that help our body function begin to slow. To compensate for these changes, our body will overexert other processes to maintain the balance within, which can increase the risk of disease and cognitive decline. So now that we have defined aging, made it a little simpler, let's talk about the challenges we face with aging. What are a few risk factors of aging? These are a few of the challenges older adults face as stated by the Population Reference Bureau. In regards to health, United States obesity rates have gone up to 41% as of 2015 among the senior population, which can give rise to many other significant health issues. Additionally, more seniors are living with Alzheimer's, and this number is expected to grow to 13.8 billion by 2030. As it relates to resource capacity, the amount of seniors residing in nursing homes is expected to increase by half in 2030 to 1.9 million. This, of course, places a greater pressure on nursing home staff and caregivers and the plans to build more nursing homes to meet the demand of the growing senior population. Medicare and Social Security spending is also another resource that will be impacted with the growing senior population. Now, Moving on to poverty, racial minorities are twice as likely to live in poverty than white seniors, resulting in financial barriers, especially among Black and Hispanic seniors. Finally, let's talk about the current gaps in resources that we find among the senior population and how they may be addressed. Education is one gap that has a variety of modes of implementation. Instituting programs that educate employers on the heterogeneity of aging to combat ageism is one way education can bridge gaps and bring attention to the stereotypes associated with aging. Educating older adults on newer technology is another way the gaps in accessibility can be addressed, as many seniors may not know what resources or how to use those resources and if they're available, what is available to them, such as transportation, health, or food services. Promoting social programs and services that directly benefit the communities affected by lack or those who face economic barriers is another significant gap that could be addressed with a greater plan of action for these programs. With the rise in the senior population, there's also going to be a greater need for caregivers, both family and professional, which would also fall under these social programs. Finally, increasing the circle of impact with programs such as Medicaid are crucial. To ensuring that our seniors are able to meet with primary care providers is another way that we might be able to address just some of these gaps. So just a brief recap. Throughout this presentation, we have discussed significant data surrounding the senior population across the United States and defined important terms such as heterogeneity and aging to gain a better understanding of their role in the senior population. We then ended with a discussion of the gaps present in the senior population and the way they may be addressed. Aging does not follow a universal straight path. People age at different rates and require different resources, which is why it is important to understand the challenges and current gaps in resources seniors face today in a country that is getting increasingly older. So think about the older adults in your life and how they have aged, any challenges that they have encountered, and what do you consider important in the aging process? We want to thank you for your time and joining us for this presentation today. We have a number of resources available to you. And we want to thank the creator of this information, Ms. Aileen Vela, who is a University of Michigan Future Public Health Leaders Program intern for 2022. And thank you.